it's not going to work. It's how much is it going to benefit you?
Well, there are non-responders.
Okay.
So I guess the point would be that in certain cases, we don't see enough benefit to continue.
In today's video, we're going to be talking about TMS therapy not working. With me today, I have Dr. Kevin Murphy. Doc, can you tell us a little bit about who you are?
Thanks, Kyle. Yes, I'm an oncologist by training, specializing in pediatric and adult brain tumors with a process called radiosurgery. And the last 10 years, I've spent time working on a personalized approach to transcranial magnetic stimulation.
So, Doc, can you tell us a little bit about TMS therapy not working on somebody?
So TMS is a daily outpatient therapy that requires cooperation 5 days a week, 20, 30 minutes a day of brain stimulation. And our patients come in likely, most of them, on some form of medication management or drug use. They have a history of trauma in some cases, physical trauma in many cases. So it depends on the brain state that we first analyze when you come in, whether they have a likelihood for response or not. In standard TMS, there's not a modality that's commonly used that looks at the brain state. In contrast, with personalizing our TMS, we do an electroencephalogram. It takes 5-10 minutes. It's a wireless 5-10 minute exam, and it tells me 19 different brain locations and how they're behaving over time. And that tells us a lot about the person's likelihood for response. And I do get cases where I see a brain state and I tell the parents or the patient, I'm concerned here that the brain has enough damage or enough lack of waveform that this will be a tougher case. Let's see how it goes. The good news is I can see the brainwaves change and know they're going to be a responder within the first 10 days or so. So we don't treat patients for months and say that didn't work, sorry. They're going to tell us it works by taking the scores. We're going to monitor their brain state. And if I get 2 weeks in to a patient and I'm not seeing brainwave changes and scores go down, then we usually tell them you're in that non-response group.
Okay.
And in our experience with personalizing our TMS, we're getting about maybe a 5 or 10% group who has a moderate to poor response.
Okay.
And the other group is having clearly a much better response.
So with PRTMS, it's not that it's not going to work. It's how much is it going to benefit you?
Well, there are non-responders.
Okay.
So I guess the point would be that in certain cases, we don't see enough benefit to continue.
Gotcha.
It's uncommon to see that. Even in cases where we're told the patient's not responding, they'll be sleeping better, have less anxiety.
Right.
They'll have things that have improved.
Right.
They're not getting speech, let's say, in a mute child, but we're getting eye contact and sleeping and less picky food behavior. So sometimes there's a metered amount of benefit.
Gotcha.
Sometimes there's dramatic benefit where I have kids that only have a few words start speaking in full sentences.
Yeah.
So it just depends on what the brain state looks like, excuse me, when they arrive, and we get to monitor that when we treat patients with PRTMS.
Hey guys, if you found that video informational, want to see more, do me a favor, click this video right here while I enjoy my TMS sessions. Did you click it? Click it already. TMS, it's life-changing. This video right here is going to help you.